reckon we can start. So hi everyone, my name's Qui. I'm a 5th year dental student and I'm intercalating this year. I'm part of the Beat This Together Society in Bristol, and this week is National Eating Disorders Awareness Week. It's quite a mouthful, so EDAW for short. And in light of that, I wanted to raise awareness, particularly in the sort of impact eating disorders can have on oral health. So specific to dentistry, but it's also so relevant to everyone else. So it's open to all, not just dentists. And Eleanor's going to kick us off and tell us a little bit about BEAT in our society.
So I should unmute myself. Okay, so BEAT is the UK's leading eating disorder charity. So it aims to end the pain and suffering caused by eating disorders. So they do loads to help people and family of people with eating disorders. So they run a helpline online and on the phone that you can call at any time if you're struggling. And they also hold peer support sessions for family and friends of people with eating disorders. And as well as all the support they also campaign for better understanding amongst professionals like doctors about eating disorders and for better funding for treatment. So Beat This Together at Bristol is the Bristol Society for Eating Disorder Awareness and Body Positivity. So we run educational events like this, and then we also do some fundraising and activities to promote good body image, such as yoga, mindfulness classes and things like that. One of our big achievements of the last year was some of the committee members worked on the motion passed by the SU to ensure that sports providers were aware of possible harmful language and fat phobia in their classes. So yes, that's who we are.
And just to add to that, we've been going into like university sport teams as well, and giving educational talks on how eating disorders can manifest in like different sports and how to sort of or like where to spot them and like where we can point these individuals to. And also sorry, Pepe, I think you're on speaker. Sorry about that. Yeah, so I'm just going to introduce you to a wide variety of eating disorders that are out there. So the ones most commonly known are Anorexia Nervosa, so anorexia, and Bulimia Nervosa, also known as bulimia. And those are the typical ones people know about, but there's also so many more. So there's binge eating disorder, also known as BED, which is what our EDAW week is focused on. But unfortunately, there's not that much research out there, especially in the dentistry field, on the impacts of oral health that it has. And there's also OFSED, so other specified feeding or eating disorders, and avoidant restrictive food intake disorders, also known as AFRID. So I'm just going to tell you a little bit about binge eating disorders first, as it's our focus for the week, but unfortunately, as I said, there isn't that much research into the impacts of oral health it has. So binge eating disorder is basically a serious mental illness where people eat large quantities of food without feeling like they're in control of what they're doing. So it's actually the most common, but it's actually the least understood eating disorder there is. It can affect anyone of any age, gender, ethnicity, or background, and it commonly leads to significant weight gain because these individuals don't compensate for their binge eating behaviours, and so they tend to gain significantly more weight than other eating disorders. They normally eat, so in a binge, they normally eat much faster than normal until they feel uncomfortably full, and they eat like when they're not hungry, and often they feel quite guilty and shameful from it, and often socially withdraw and isolate themselves and end up eating alone through embarrassment. So they can also plan these binges, and that's quite typical for them to almost like plan their week or days around it and buy like special binge foods to indulge in these behaviours. So I'm going to talk and focus this talk more on anorexia nervosa and bulimia nervosa, as that's the most well researched in the dental field. So anorexia nervosa is the fear of gaining weight, which leads to dysfunctional eating patterns, severe malnutrition through inadequate intake of calories and excessive exercise to lose weight. And often these individuals commonly develop these rules around food which they can and can't eat, and like timings they can and can't eat, and when and where they can and can't eat. And this typically affects girls aged 14 to 17 years old, so around their teen years, but it can affect anyone of any age, gender, ethnicity, or background. And bulimia is typically associated with anorexia nervosa, but it's separate, but it still holds the same principles that they're trying to lose weight, and they hold this idea in their head, but they instead have this compensatory behavior to lose the weight. So they typically binge on food, and you can see in the cycle here, they binge on food and then they engage in this purging activity, which can manifest as like self-induced vomiting, which is the most common, but also consuming laxatives, and also carry out excessive exercise in order to compensate for that binge behavior. And so this leads to a sort of vicious cycle of restricting their diet and then binging again, and then again taking part in that purging behavior. And it's not, these symptoms aren't just isolated, so they can self-induce a vomit, consume laxatives, and over-exercise, or they can do these activities individually. And Ileana is going to tell us a little bit about her experience of her eating disorder.
Okay, am I unmuted on Zoom?
Yes, that's good.
Okay, let me just get my notes up quickly. Sorry, I don't think I'll be able to look into either camera directly because I've got two screens set up, so I'll just be reading from here. So hi, my name's Ileana. I'm one of the co-presidents of Beat This Together. My experience of eating disorders started when I was about 9, after a period of illness that caused me to lose weight. Neither my parents or my GP really recognised what was going on. And as far as I was concerned, hiding food or throwing it away felt like a sort of game that I was playing against my parents. Having struggled with anorexia in my teens, I tried to recover on my own when I was starting my A-levels. And ultimately this was not successful without specialist support, and the guilt that I experienced of eating again resulted in me doing a sort of about turn and then developing bulimia. In the thick of it, bulimia felt like a vicious and pretty never-ending circle. I was punishing my body for the food that I'd eaten by over-exercising, restricting, and then from the restriction, as we saw in the diagram that Kui showed, then snapping and binging before vomiting in secret in my bedroom or in the bathroom while my family was still downstairs finishing their evening meal. I would try and do a day eating normally. I wanted to stop what was happening, but ultimately I was still scared of food, and eventually pressure would sort of build inside me until I would commit consciously to the sort of punishing act of binging and then purging. So purging, vomiting what you've eaten. I had sores on my knuckles from purging, which is a very common sort of telltale sign. Not everyone has it, but frequently you do see it in bulimia. Chapped lips, bloodshot eyes from the pressure that builds up in your face when you self-induce vomiting, abdominal pain from the food, but also from the abuse of laxatives, which is another common bulimic behavior, and my throat was always raw and I frequently coughed up blood. So the dangers of bulimia are well documented, and I'm sure that it will be no surprise to the dental students that are here this evening that this had an effect on my oral health. I was so worried that people would find out about what I was doing and try to make me change these behaviours. And while it was bad for me, they were coping behaviours, and I was clinging on to them more firmly the more sort of entrenched and unwell I became with the eating disorder. I would spend a long time cleaning up after myself, sort of scouring my hands and really harshly brushing my teeth straight away after vomiting to try and remove any trace of what I was doing, any smell or any like traces of vomit. Of course, brushing your teeth immediately after purging is not recommended, but I didn't know or really recognize this at the time. I frequently had ulcers on my tongue or in my inner cheeks from the acid that was being brought up into my mouth, and I needed 2 fillings around this time. I can remember x-rays showed sort of points of weakness in between where teeth would meet. And yeah, considering how frequently I was engaging in these behaviours over the course of that year, my first year of A-levels, I am quite surprised that the damage to my teeth is not worse than it has been so far. So I avoided seeing my dentist during this period, and being under the age of 18, I was just really, really scared actually that the dentist would pick up on the signs of bulimia in my mouth and then would disclose this secretive behaviour that I had to my parents. And I think it is important to note here also, this is something that was picked up in our Instagram polls, that I would have been incredibly sensitive at this time to any comment from my dentist, especially if they had instructed me to just cut out and stop the vomiting completely, because this wouldn't have really been a possibility. I was already trying. It would have been alienating to hear this from my dentist. I knew that I was wreaking havoc on my teeth and on my body more generally, but I felt completely disarmed to stop this behavior. And yeah, the wrong advice from a dentist at this point, I think, could have possibly resulted in me just deciding to never attend future checkups. So in some ways, I'm grateful that my dentist never broached it, but then I never disclosed it either, and maybe it wasn't that obvious. But it's something to bear in mind. So yeah, in an effort to leave bulimia behind, I ended up falling back into restrictive habits and quickly became very unwell again with anorexia. So out of 15 years of having an eating disorder, this is the one that has really challenged me. And thankfully, I pretty much left the bulimic behaviours behind when I was 17, and I'm now nearly 24. So yeah, emotionally, for me at least, anorexia was very different. It's isolating, you feel guarded, it's secretive, it's regimented by rules. In the space of 6 months after this episode of bulimia, my way of navigating the world that I was in had become completely anchored to restriction and exercise. I'm sure that many of you can remember the stress of your final year of school, university applications, the unknown, the exams, the possibility for change that you don't have control over when that final year of school comes to an end. And I nearly didn't manage to sit my A-levels because I was unwell. But I was finally receiving some specialist support, and so I managed to surpass the grades that I needed and get into Bristol, and I came straight away. I didn't take a gap year. I'm now a master's student here doing psychology, but I studied languages for undergraduate, and my student experience for those 4 years was really honestly shaped by anorexia, and it's only in hindsight now that I'm really becoming aware of the extent to which the eating disorder really stole my student experience away from me. I was unable to do the year abroad. I went to Paris, but quickly I had to come home because I relapsed. And I spent the year at home on my own, attending therapy, feeling like I was falling behind everyone else my age who was doing fun things and making new experiences that I just couldn't do. And I had already committed to recovery before that year, but as is the case with all mental health issues, recovery isn't a linear process, and this was no different for me. So I returned for my final year in 2019, and I quickly relapsed before Christmas of that year. And yeah, this almost resulted in me ending up in hospital and having to drop out completely. So I'm really thankful that it didn't come to that, but it was pretty serious at the time. When someone is suppressing their body weight through purging and through laxatives, food restriction and exercise, things start to go wrong very quickly when you're looking at their overall health picture. So I remember blood tests would just show deficiencies in all areas. Purging specifically can cause imbalances that really affect the heart. And malnutrition can also result in lowered bone density, which was the case in my experience. Of course, in terms of my experience with a dentist, this means that I may be at an increased risk of bone fractures, or that my teeth maybe have become weakened as a result of starving my body. So that's another thing that you can bear in mind when you perhaps one day are treating a patient with or with a history of a restrictive eating disorder, no matter their apparent state of health when they come to you in practice. Low mood as well in these times, in my experience, can lead to sort of self-neglect. Things like washing and brushing your teeth just completely go out of the window for weeks on end sometimes. And my diet often also around these periods was very high in sort of acidic fruits and acidic vegetables because they're lower in calories, and this affected the appearance of my enamel. It's sort of translucent or shiny on the outside in places, and this is as a result of disordered eating behaviours. Mostly due to the pandemic, but also because I'm kind of scared of things going wrong at the dentist. I now haven't seen my dentist in over a year, and I would be surprised if after the sort of blips and things that I have had with the anorexia over the past couple of years, if there wasn't more damage that they pick up in my next appointment to my teeth. So yeah, I've tried to gear what I am saying this evening as much towards oral health as possible, because it is a dentistry webinar, while also giving some sort of insight to the emotional aspects, because of course when you're treating patients this is also really important. Of course, the experience of an eating disorder is far more complex than I have been able to go into this evening, but I hope it has been helpful to you guys nonetheless, and that you have perhaps gained a fresh perspective on this mental illness and the patients that you may treat that have experience with it, or that you've learnt something new. And I am pleased to say as I finish up that I am currently doing very well and that my recovery is going in the right direction. So hopefully no more dental issues from the eating disorder from this point onwards. But yes, it is not a straight path. And yeah, thank you guys for listening to my experience of eating disorders and how it has affected my teeth.
Thank you so much, Ileana, for sharing your journey, and well done in your recovery process. That's so brave and encouraging to hear that it is possible. But likewise, like Ileana said, it's not a linear process. So well done for persevering. And also thank you for highlighting those dental problems and experiences you've shared with us tonight. Sorry, I just want to check with the Instagram Live that it's still working on your side, because there's a lag on my side.
We can hear the lag is the only issue.
Well, if you're listening to the Instagram Live and the Zoom at the same time, I think you can hear a lag. I don't know, on my screen I can see myself talking on the live, and then there is a like loading button for both Eleanor and Qui, so I'm not sure what's happening, but I guess we'll be able to upload the recording for those on Instagram if it's not working.
Should I like reset the live, because otherwise we're going to have a talking phone in the background?
Okay. Yeah, we can do that. I don't know.
Okay. Does it delete it instantly if I don't share it instantly? Or do we not know this?
I didn't realise I was muted. Yeah, I'm not sure.
Okay.
Mm.
Okay, let's try and restart this. Apologies, guys. Thank you for bearing with. Okay, I'm just going to add you to the room. Oh, I think you need to log into the Insta room again. Sorry about this.
That's all right. I've got it. Okay, I'm on it now. I've asked to participate.
Okay, thanks. Okay. I think we're good.
Okay. Fab.
So Ileana's touched on this, but I just thought I should provide a summary of all the other sort of medical complications an eating disorder can entail, particularly anorexia nervosa. So the typical symptoms are weight loss, hair loss and dry skin, retarded growth, because ultimately, like, you're depleting your body of calories, minerals, vitamins, nutrients that are essential for growth and repair. So you've got a lot of metabolic changes going on, which result in that lower body temperature, retarded growth, hair loss and dry skin. You also affect your hormones. So for women in particular, they'll lose their menstrual cycle or have very irregular ones. And also they tend to develop osteoporosis. Like Ileana was saying, like her bone density became quite low and is still quite low actually, and it takes many years to recover from that and normalize that again. You also get muscle wasting from that depletion and all those calories and minerals and nutrients to your body. And in the most severe cases, which are often when these patients end up in hospital, they tend to develop heart problems, and all the other organs start to fail, like their kidneys as well and livers. And this very sadly can result in possible death. And for young teenagers who experience this and are hospitalized, they have a 12 times increase in the likeliness of death in comparison to people their age, which is extremely shocking. And you can just see the dangers of an eating disorder. And so I'm going to highlight a few statistics how COVID has impacted eating disorders over this last year. So in 2018, there were 725,000 people in the UK with an eating disorder. And over the pandemic, it's gone up to 1.25 million people now. And worryingly, the BEAT services have seen a significant increase in the demand for their services. By 97% between March and August, their services were in extreme demand. And I just want to highlight that 87% of these who are calling in to BEAT reported that their symptoms had worsened over the pandemic. So a lot of people were relapsing, and also a lot of new cases of eating disorders were being identified as well. And you can see that in the surge of online group attendances in their services. And so I'm going to just outline this study that was recently carried out last year over the pandemic period. Quite early on, they recruited a small sample. They recruited 129 individuals between 16 to 65 years old. The majority of these were female, but all of these were experiencing an eating disorder or in their recovery process. And they found they found that many of these, so it was a qualitative and quantitative study, and these are the themes they identified. So disrupted living situations, increased social isolation and low feelings of social support, reduced access to support networks, so family members, friends, and changes to their physical activity rates as well. They also experienced reduced access to healthcare services, which they commonly receive in their treatment. So that can be like a psychologist, a nutritionist, a physician, doctors, all of those services were of limited access because of lockdown. They also had disrupted routines with everything changing, and they also experienced changes in their relationship with food, and particularly they experienced an increased exposure to triggers, messages on social media, which enhance their eating disorder and almost help them to, or not help them, but cause them to relapse. And they also experienced increased rumination, so thoughts about disordered eating, and felt like they lost control over all of that. So what are the impacts of eating disorders on oral health? Ileana sort of touched on this. These are the ones these are the symptoms which are most researched in the literature. So dental erosion, dental decay, salivary flow, gum disease, changes in so the oral bacteria, enlarged salivary glands, mucositis, which is sort of inflammation of the oral mucosa, so like inside your cheek tissues, and mouth ulcers and bruxism. And the ones with the most significant findings and the most relevant to dentists are dental erosion and dental decay and salivary flow, which have been highlighted mainly in these two studies here. So going over these two studies, so this study was looking at the differences between those with anorexia and those with anorexia and bulimia, and they compared those, and they found that dental problems they experience, they have significantly higher risks of developing dental problems, burning tongue, dry and cracked lips, and dental erosion. And those that engaged in binge eating behaviours and self-induced vomiting, they had significantly more dental erosion than those who didn't engage in those behaviours. And the longer the duration of their disease, so their eating disorder, the more severe their dental erosion was. And this study was a meta-analysis and systematic review, which looked at the outcomes specifically focused on dental erosion. DMFT is basically the number of fillings they have in their teeth, so referring to dental decay. And also they looked at salivary function, and they found all of these had an increased risk of developing all of these diseases. So we talked a lot about all these symptoms, but I haven't actually defined them yet. So dental erosion is the irreversible loss of tooth structure, and it's caused by acids. So there's intrinsic acids and extrinsic acids. Intrinsic acids are from self-induced vomiting, because vomit is particularly acidic, and patients with eating disorders which engage in self-induced vomiting have significantly higher levels of dental erosion. And particularly you can see these patterns, if you can see my mouse, they are on like the occlusal surfaces, so the top surfaces of the teeth, and also the palatal surface, so behind the central incisors on the inside of them. And you can see the significant wear that it can cause. And the yellowness of the dentine can start to show through the more severe it gets, as the enamel dissolves in the acidic environment. And talking about extrinsic acids, these are acids from the diet. And so in particular, like Ileana mentioned, she had quite a high fruit intake, which is very acidic. and other people with eating disorders have also reported that they drink a lot of fizzy drinks, which are also very acidic and have a general low pH in their dietary intake. So all of these will cause a significant risk to developing dental erosion. And in that meta-analysis study, they found that patients had 5 times the odds of developing or having dental erosion compared with controls, the controls being completely healthy patients. And those who self-induced a vomit in their eating disorder, they had a significantly higher odd than that of 7.32. And so this slide just shows the progress of dental erosion. So initially you lose the sort of surface texture of the tooth and it becomes very shiny and smooth. And eventually it starts to thin and become more translucent, as you can see in these pictures on the far right here. And the yellowness of the dentine starts to show through. So that just shows how tooth erosion can progress. And depending on their behaviours and how frequent their intakes are of acidic foods, and also how frequently they're vomiting, determines the rate of progression of tooth erosion. And dental decay was another significant finding they found in individuals that with eating disorders. So dental decay is the loss of tooth structure involving bacteria. So therefore it's different to erosion, as erosion is purely based on acids and no bacteria is involved. And it's important to consider that dental decay, although it's found as a significant finding, it's multifactorial. And so you can't completely attribute dental decay developing from an eating disorder. It can be from many other factors as well. But they found, so in that meta-analysis I mentioned earlier, they found patients who do not vomit had significantly higher numbers of fillings, and also patients that self-induced a vomit had significantly higher numbers of fillings as well in comparison to those controls and those who did not self-induce a vomit. And interesting, a study looked at sort of the patterns of dental decay in these individuals, and they found that decay more likely to appear in the sort of buccal lingual surfaces, so the outsides and insides of the tooth, so the cheek side and the tongue side, and also the proximal side, so in between the teeth as well. If you can see my mouse, so those are the proximal surfaces, and that's the buccal lingual aspect. So not so much on the occlusal surface, but it can spread there too. And the last significant finding which these studies looked at was decreased salivary flow. And this can have multiple impacts down the line. So with reduced saliva flow, you also have a reduced, so the bicarbonate ions are ions in the saliva which are responsible for remineralizing the tooth structure. So every time you have a food intake, you attack your teeth and that causes demineralization of the tooth tissue. But these bicarbonate ions in this saliva remineralize that tooth tissue and harden the enamel again. And so with decreased saliva flow, you have reduced buffering capacity, which can lead to the risk of developing dental decay and dental erosion, but also xerostomia, which is dry mouth, angular colitis, and you can see that in this picture on the bottom right here. So in the commissures of the mouth and the corners, you've got this reddening of the skin around it. And you also have oral mucositis. So like I mentioned earlier, so your cheek tissues and oral mucosa can become inflamed from having a reduced saliva flow. And lastly, an enlarged parotid gland. And interestingly, they did a study specific to bulimia on this, and they found that reduced salivary flow was a common feature in these patients, but actually it was due to the antidepressant medication they were on. So as Eliana sort of outlined in her a story, like there's a huge psychological component involved in this, and many patients with an eating disorder have this complex psychological component, and many of them actually experience depression and low mood and are on antidepressants, which can cause a reduced saliva flow. And this study basically says that it's actually not the eating disorder causing it, but it's the medication. And also, so I mentioned enlarged parotid gland, so that's your main gland in delivering saliva to your mouth. This study found that actually this enlarged parotid gland was found in some subjects, but it was not a significant finding, and it's only the minority. So when dentists are looking for the signs of eating disorders, this study sort of suggests that actually some might have this, but it's probably better to focus your findings on things like dental decay and dental erosion, which have in all the studies highlighted to be significant in eating disorders. And gum disease has been one that's been widely researched as well in the limited research that there is. But I thought I'd mention it as it's mentioned so commonly in the literature. So gum disease is this chronic inflammatory condition affecting the soft and hard tissue structures that support the teeth. So this includes the alveolar bone and the periodontal ligament. And it's caused by harmful bacteria, which progressively eat away at the bone and the periodontal ligament. So the periodontal ligament is a thing that holds the tooth in place into the bone. And so when this bacteria eats away at that, there's a lot of inflammation and bleeding, and these teeth often become wobbly because they lose their support. And so the studies around it showed that the results are conflicting to whether there is an association between gum disease and eating disorders. So some subjects were found to have less gingival bleeding. So gingival bleeding is a measure of gum disease, but also the depth of that pocket that the dentist will be investigating. But other studies found that these subjects had increased gingival bleeding. So the evidence seems to be conflicting. But the theories behind it is that there was, in these patients, they often have reduced or they're commonly very malnourished, so they have reduced mineral deficiencies and nutrients in their body, so such as vitamin C and D. And so that is the theory behind causing the progressive destruction of the alveolar bone and periodontal ligament, and also almost weakening these tissues, but no strong associations have been found in that. And so this is just a summary which was beautifully drawn by Ileana and can be found on our our Beat Instagram page. So summarizing that these patients commonly experience high levels of decay, dental erosion, reduced salivary flow, and a complication of that dental erosion is that often these teeth become very translucent and shiny, so that's a large aesthetic concern. And like I mentioned, the teeth often appear very yellow as well. But also with the dentine being exposed, these teeth can also feel quite sensitive and painful. So there are many oral manifestations involved in this. And as Ileana mentioned, that she had reduced bone density, and that can impact the jawbone, so increase her risk of fractures, not only in her jaw, but her body as well. So yeah, this slide is just a good summary to show actually the mouth is a mirror of oral health. And so the BDA, they published this in 2018, but it's just really encouraging to show that there is an increased recognition over the last few years in like the awareness of eating disorders in dentistry, and actually it highlights that we have a unique role in actually identifying these patients and spotting these early warning signs. One study actually showed that these oral symptoms can develop within the first 6 months, but obviously it depends on the individual sort of behaviours and engaging with these eating patterns, or disordered eating patterns, in fact. And without the time, training, or appropriate pathways, we can't unlock the potential to diagnose and intervene and help these patients early. So I think there's definitely a need to develop more strategies and links with those professionals involved in helping these patients with eating disorders. I don't know. Oh, here we go. So managing these patients with eating disorders, we've highlighted that many of them experience dental erosion. And so the NICE guidelines that were published in 2017 suggest to avoid brushing immediately after vomiting, because as soon as you vomit, the enamel is very susceptible and very soft. So when you brush it, you're going to wear it down even further. So avoid brushing straight after a vomit episode, and rinse with non-acidic mouthwash or water, and avoid large quantities of food and drinks that are highly acidic, and aim for a more balanced diet. And more important, or not more importantly, but another thing that's really important is to continue to check in with your doctor or dentist, because they can really help you and monitor you, because even like Ileana mentioned, that it's not a straightforward pathway, and it's not a straight line in recovery, but actually, like, these professionals are there to help you manage your symptoms as well as your initial cause for that eating disorder. But managing the symptoms and being well educated in being smart about your behaviours is really important, as it's a long recovery process. And like, after discussing these topics with some of the BEAT committee, I was telling them about some of the oral hygiene advice dentists typically give. So, for example, those who have dental decay, we normally suggest, have 4 servings a day, reduce your sugar intake and acidic food. But actually, this is really questionable, as it can be really challenging and harmful for someone who has an eating disorder. It almost might encourage them to further involve themselves in this behaviour, as they may see it as, actually, I need to restrict even more foods than I am originally. Like, these patients often limit themselves to very low calorie diets and base most of their diet off citrus fruits and low calorie vegetables as well. So telling them this might actually be really unhelpful and further progress their symptoms. So I think it's definitely something that needs to be discussed more. And I mean, there are no exact guidelines to how we can manage these patients. So that's definitely something that we need to develop strategies towards. But other things are like tailoring oral hygiene advice to them, and making sure that these patients have regular dental visits, I think, is really important. Like I said, it's not an easy recovery process, and it's not a quick recovery process. And dentists have a really unique place in seeing these patients regularly, and especially across a lifetime. Many dentists see families and see these kids grow up, and can see them right through to their adulthood. So actually, dentists have a really unique place in helping monitoring their condition and their oral hygiene, or oral health as well. And I think education on this, so educating your patients who are susceptible to eating disorders or already have an eating disorder, is really, really important in making them aware of the dental implications it can have, and also ways which they can almost reduce the symptoms or severity of their dental symptoms, and communicating that effectively. So Ileana mentioned earlier that actually she was very scared of going to her dentist. But actually, if we are careful with our communication skills, and making sure these individuals feel like they are in a safe environment, is really important in helping them open up, and it can really help just help these patients get better in their recovery. So managing the patient as a person, not just their teeth, is so important in this. And so actually, this is quite an interesting one. We put these polls on our Instagram stories, and this is the response we got. So this shows that many are actually put off by going to the dentist if they have an eating disorder. And we also asked if people's dentists have addressed their eating disorder during their dental checkup. And as you can see, many of the responses showed that the dentist didn't at all. And I thought this was a really helpful one. So we asked if there was anything that these individuals wish their dentist knew about eating disorders, and these are some of the things that they shared with us. So I'm just going to leave that there for people to just have a read. And so that's the references. So what next? So we asked a few more questions specifically to dental students in Bristol. And I know the responses look quite small, but some are better than none. So we have received teaching on eating disorders in our training, and they were part of our sort of overall human disease module. So it's like an overview of medicine. And it was actually very brief, and that can be shown by this question we asked. So we asked whether people felt that the teaching provided was satisfactory, and whether we felt well prepared in our career. And as you can see, the majority of the responses say no, people don't feel prepared. And people aren't aware at all of the resources available, and actually there are very limited resources. So there are no dental specific ones, but on the BEAT website, there are resources sharing sort of how to help like a family member, how to help a loved one with an eating disorder, and those can be specific to family members, friends, teachers, but there's no specific resources for dentists. And I thought this was really interesting actually. So when we asked whether people had a personal experience of eating disorders, many suggested that they either had a friend or family with it, and many actually responded that they experienced one themselves. So it's a very prevalent condition that we should be aware of, and it's exciting to see just even on Instagram that there's so much recognition at the moment, but it's definitely important that we keep pushing for more recognition in this area. And we asked whether people would be interested in an e-learning sort of thing, and this is specific for dentists. So the responses looked very positive, with 90% very interested and 10% being maybe. So the plan is, well, I would really like to work with a team to develop this sort of e-learning that can be accessible to both dentists and dental students. And it'll be great to actually get this going very soon, as it's so relevant, and you can see that the number of eating disorders have dramatically increased over COVID, and the number of patients we'll be seeing with these eating disorders is definitely going to be more prevalent. So I definitely think it's something that we need to be well educated on now, and feel confident in addressing. The medical school, so our president, Tori Friedman, who set up the society, she's been working on this e-learning resource for medical students in Bristol, and that's going to be very ready very soon. And the hope is that we can almost adapt that, but as with dentists, we have a very different position to medics. We don't directly treat the anorexia nervosa or bulimia or the eating disorder itself, but we treat their oral health. And I think it's so important in knowing sort of like how we can refer these patients, how we can communicate with these patients, how we can like best manage these patients and have those sensitive conversations. So I think an e-learning module will be really helpful, and it'll be really accessible to both dentists and dental students. So it'll be really great to get that off the ground. And if you're interested in taking part in that, here's my email below. Please do email me. We'd love to get a wide variety of people involved, so both dentists, dental students, or even like other members of like other healthcare professionals that are involved in helping these individuals. And so we hope to integrate this into the dental school curriculum, and that's why I was asking people to fill in the response form, so we can create a sort of letter to the dental school and ask this to be implemented into our curriculum. And also I was hoping to make this more accessible to dentists as well, not just the dental students, by creating some sort of CPD course. So yeah, this is a summary with Ileana's wonderful drawing again. And if you wanted to put this up in maybe like your patient waiting room or anything like that, or around in the dental school, I can definitely email these out, because I just think it's a really great summary and really great picture summarising the impacts these eating disorders can have on oral health. So thank you for listening. And any questions are welcome, either on the Instagram live or the Zoom. We'll be watching out for both chat boxes. And people can also unmute themselves if they'd like to.
I think Tori might have set it so that people cannot unmute themselves. I'm not sure. Tori, she's on the call, so if she has, then she can sort it out.
That was probably my mistake.
Yeah, if people want to unmute, then they can. And I think as Qui's going to go on to check out our other events for the rest of the week. We've got lots of things happening this week, and make sure that you're following us on Instagram so that you get all of the latest updates.
Yeah, so our Instagram's just down below here. So Bristol Beats Eating Disorders. And we've got lots of stories coming up and events as well. So do follow us.
Actually, I have a quick question in terms of the damage that you outlined that can occur from having an eating disorder. Is most of the damage caused reversible if you recover, or is a little bit kind of a permanent thing?
I hate to say it, but most of it is irreversible. So with both dental decay and erosion, are you hearing an echo? Sorry.
Only a slight one.
Okay, we'll go with it. Yeah, so with dental erosion and decay, they're both irreversible processes, and you lose the tooth structure. So the only way of replacing that is by like dental fillings, and in like severe cases, like crowns and bridges and like more advanced restorative work. So I hate to say it, but that's why prevention is so key, and intervening early is so key. And having that really good sort of like oral hygiene routine in place is so important, as well as managing those sort of like dietary intakes and like vomiting episodes. And I know, like, as I said, I know it's like a really challenging recovery process, and it's very long. So we actually have to be adaptable to that, and be aware of actually like we might not be able to fix it instantly, but it's about managing slowing down the rate of those diseases progressing. So, yeah.
Also, Qui, actually that follows on from that last question. Is it worth trying to wear a night guard then after, if you've damaged your teeth, maybe to stop further attrition?
Yeah, I think that's a really good point actually, Pepe. Definitely, I'd say in those that so bruxism is basically like the grinding of your teeth, and in particular a lot of people who experience bruxism do it at night when they're asleep, so when it's not like a conscious process, and also people do it when they're stressed. So wearing a night guard will definitely help reduce the wear of those teeth. But actually, if you've got to sort of look at the causes and the patterns of someone's eating disorder and like the symptoms they have. So if they are a bruxist, that would be really helpful, but maybe if they aren't a bruxist, it might not be as helpful. I'm not too sure on that, but I think it's so important to just make sure like you take a good patient history and you know all the patient's behaviours to help manage all these symptoms. And I think that's why it's so important to create that sort of safe environment for them to feel like they can open up to their dentist properly.
And Quiyi, just one for Ileana. I don't know if she can actually hear at all. I missed the very first beginning bit of the talk because I was just getting back from work, but did she disclose to her dentist that she had an eating disorder, or did the dentist pick it up from her dentician?
Hi there. I can't see who's speaking, but yeah, when I was below the age of 18, I didn't disclose it to my dentist. I said in the when I was speaking, I was quite anxious about anybody finding out and being able to pass on to my parents that I was engaging in these behaviours, even though they knew something was up. I think for them, especially while I wasn't, you know, literally sort of collapsing frequently, you know, from malnutrition, while it was sort of manageable-ish, they were also sort of sticking their heads in the sand about it. So I was very nervous about them possibly finding out, and therefore me being taken into mental health services and being forced to recover when I didn't want to and I didn't feel ready. However, since having been with mental health services back at home and seeing a private therapist, I do now disclose when I go to the dentist that this is something that I have experienced. As I said, it has been a while since I've been to the dentist, mainly due to the pandemic, but I'm much more open about it now, and that includes every health professional that I'm in contact with.
So did you feel, Ileana, did you feel that you didn't have enough faith in your dentist not to say something to your parents then?
Well, the dentist that I see, I really trust that he really knows what he's doing. And it is a dentist that my whole family sees and have seen for as long as I can remember. And I think if you were to ask me this now and I didn't disclose information like this now to my dentist, I would say, no, I understand that they would respect my right to confidentiality, especially as an adult. But at the time, being under the age of 18, I was very mistrusting. And generally when someone is ill with an eating disorder, they can become very protective of the behaviours that they're engaging with, and in keeping things like this a secret. It's also very common to sort of not really recognise that you have a problem and not recognise that you're ill. So you may not therefore understand that this is something that you need to explain is going on. But yes, at the time I would say I was too frightened of anyone forcing me to stop this behaviour that was being used as a coping strategy, that I trusted nobody, and I was secretive from even my closest friends really about all of this, until it became so overwhelming that I had to sort of relinquish control and let somebody help me.
That's great. Thank you so much for being so honest.
That's okay.
Pepe and Nicola, I've got a question for you, and like any other dentists out there as well. So if a patient presents to you and is willing to open up about their eating disorder, but doesn't want you to disclose it, doesn't want you to disclose that information to like their parents or GP, and I'm particularly referring to the GP here actually, because obviously with eating disorders we can see that they can have like really significant consequences to someone's health, and in extreme cases result in death. Like, to what extent and when can we sort of breach that confidentiality if it's the patient's wishes, or can we at all breach that if it's the patient's wishes?
So ultimately it's a safeguarding issue, so it does depend on the age of the person and the Gillick consent, so obviously how you think they're able to cope with any information that you might give them, and obviously ultimately if it's something it's life-threatening or is going to put them into hospital, then you will have to breach that trust and then speak to the GP. GP first. Very rarely would be parents. Parents would be after the GP, and then that would probably be the GP's decision to refer it on to the parents.
Okay, that makes sense. And how far along would you say they have to be in order for you to actually feel like you can breach that confidentiality and go to the GP if they ask you not to go to the GP?
I think by the time you've got to the stage where it's so far along, I think it'd be quite clinically obvious that somebody's suffering with an eating disorder. So obviously just physically, I think it would have been picked up way before you get to the dental stage, because physically, obviously, weight loss would be one of the biggest things you'd notice. And as Ileana said, there's lots of other things, mood swings, keeping themselves to themselves and not mixing with family and friends again, and being very solitary. So all those things would be indicators.
If I can just quickly butt in there, I would also point out, though, that some people are very adverse with eating disorders to attending an appointment with a GP about other health issues, especially if they recognise that they are suffering from an eating disorder, because they do not want to be encouraged towards getting better from the eating disorder. So often behaviours, complications relating to eating disorders will crop up in other places like A&E, like with the Mallory Weiss tear in the throat, which can be caused by bulimia. I would have thought that if I was very ill and didn't want to get help, I'm more likely to attend a dentist appointment and less likely to attend a GP appointment. So I think you make a good point, but also there are some people who are chronically very unwell and who physically you can see that they are unwell, but who will not necessarily be known to a GP in their area because their eating disorder behaviours are so entrenched and so long lasting. And again, as you said, eating disorders are most often not visibly perceptible. It's only sort of the 1-2% that are underweight when they are unwell.
Thanks so much, that was really helpful.
That is tricky though, isn't it? So if you see something and someone is 16, you can't tell their parents. It is actually a very difficult situation, isn't it?
Yeah, definitely, especially as, like I was saying, we kind of want to spot these early and intervene early before they get to a worse stage, both in their oral health and also physical health. Yeah, it is a really interesting and challenging topic that I think, yeah, definitely needs more guidelines in.
Is there any questions? I feel like I don't really listen to the talks. I don't know.
I guess my only one question, sorry, I don't know if I went over some of them, was just about obviously trying to ask somebody to reduce their acid intake. So it was for Ileana as well, really, just because clearly that would be the first thing that as a dentist you'd want to say if someone has got lots of acid erosion. You're going to start talking about the types of food that you should and shouldn't be eating, the frequency, the timing. I mean, obviously with an eating disorder, then that's obviously quite a tricky subject to broach. So how would you suggest that we talk about these things when clearly you need to reduce the acid that's in your diet and obviously is coming from your stomach as well?
Yes, it is difficult. I agree. I can remember talking with Tori, the founder of BTT, with Qui about sort of recommended number of times that you can eat during the day. And we found this quite difficult to sort of digest, because it sounded therefore like maybe if you were used to eating 6 times a day because of a meal plan that you had been prescribed by a dietitian, that this would be too much. I think Tori has just piped up on the chat to say that she'd be happy to contribute here. I'd be happy to hand over to her so that she can answer, and then you guys can get another perspective from someone with lived experience if Tori wants to unmute.
Hi, yeah, I just wanted to chip in on this one. Firstly, just to say that BEAT are working on providing guidance to dentists on how to manage this, because they recognise that it's such a complicated issue. I would say personally, I'm a final year medical student, and I think if you're concerned that your patient has an eating disorder, then I don't think that giving them any sort of dietary advice regarding reducing acid is the appropriate time to do it. Personally, I went to the dentist fairly early in my eating disorder of anorexia, and I was given the advice that I should reduce my intake of fruit and vegetables, well, fruit in particular and acidic things, and I took this to mean that I need to just reduce my intake of fruit, which at that point was the majority of my diet, and it led to extreme restriction, which almost caused hospital admission. And that was because I was telling myself that I shouldn't even now be eating fruit, the only thing that I felt safe to eat. So I think it's quite a dangerous thing to tell someone when they're in the grips of an eating disorder to take away a safe food from them by telling them that it's causing harm to their teeth. I think ultimately there isn't really a right answer to this question, because we're still trying to work out how do we tackle this. But I think that the risk of harm to the person as a whole by taking away a food group that they're currently able to feel somewhat safe eating is greater when we're looking at their physical and mental health than the risk to their oral health. That's my personal opinion on it, and from a somewhat medical point of view.
Well, that's really great to hear, actually, just straight from the horse's mouth, as it were, really, because obviously it's such a tricky subject, as you said. And like you said, if you're just only eating fruit and then a health professional tells you to stop it, that's almost like it's a carte blanche then, isn't it, to stop eating more food?
Yeah, definitely. And I just want to add to so people who are recovering from eating disorders, because they've like restricted their intake to such a small amount, for them to try and even attempt like 4 large meals a day, they wouldn't manage much in 1 meal intake, because it hurts so much from the digestive problems they'll have from recovery. So it'll be really hard for them to adhere to like a 4 meal intake a day.
Sorry, Qui, was that aimed for me?
It was just like a general sort of statement.
Oh, okay.
I was just, yeah, it was just something that like I thought about.
Very good, thank you.
Are there any more questions or thoughts on this topic? Okay, cool. But thank you so much, everyone, for coming. Oh, sorry.
Just
yep,
a
go
quick
on.
comment, sorry. I just want to
That's
ask
all right.
about, like, maybe you know other people from different unis, but like, how does it differ? How much, like, do you get taught about eating disorders compared to another uni?
So when I was asking this is sort of like insider information, and might not be representative at all, but I've got a couple friends in Manchester and a couple down south in Plymouth, and they were saying they get barely any at all, so quite similar to us. So we literally had about 1 lecture slide just summarising anorexia and bulimia, and this sort of represented their idea as an eating disorder. But like I showed in the beginning, there are so many more that aren't researched into, and they didn't really even go into the details of how it can manifest in oral health at all. So I actually had a critical appraisal project. We were literally just given a paper to read, and we were told to summarise it. And each group, so each clinical group has 8 people in, and our year group is 60 people. So 8 out of 60 people in my year got this paper, and I was one of them. And that's how I became more aware of the impacts eating disorders can have on oral health. And that is how I sort of like fell into sort of researching more about it. And because Tori set up the society, and she's actually one of my really good friends as well, she got me involved, and I just really wanted to do this dental talk to sort of raise more awareness. And it's been really great actually with this pandemic, even though it's such an awful situation, it's opened up so many opportunities to host things online, which can be more accessible to more people, including dentists and dental students. So when I originally gave this talk, it was actually just to dental students in the dental school. So that's really cool. Actually, we can open it up, and hopefully, like I was saying, we can develop some sort of e-learning we can implement into our curriculum to like increase our knowledge in this area.
Yeah, thanks. This talk has actually been really interesting. I've learned a lot.
I'm glad you found it interesting.
Yeah, thank you, Kui. It's been really, really informative, and I can see you put an awful lot of work into it. And thank you for the other girls who joined you as well. Really good.
Yeah, thank you. And thanks guys for coming along as well. And thank you so much to all the committee that have put in so much hard work as well, not just in this event, but the whole week with all our events running. And just pointing out, like, we do still have a couple more events if you want to join in. But yeah, do drop me an email if you wanted to get involved in anything. And yeah, it was so lovely to have you all in this event.
Thank you all for coming to listen.
Thank you so much. Thank you. Have a good evening.